Good afternoon, everyone. Thank you for joining us today for the next in our series of Pathways to Prosperity webinars hosted by Vanguard Communications. Today's webinar is titled Patient Transparency, Answering Tough Questions About Surgery, and will be presented by Dr. Jaime Arruda. If you have any questions during the presentation, please feel free to chat them in the sidebar to the left of your screen, and we will try to answer the Q&A part of our webinar. We will also have an ongoing Twitter feed with the hashtag Pathways by Vanguard if you'd like to join the conversation that way. Dr. Jaime Arruda is a gynecologist and surgeon at the University of Colorado Hospital. She has special practice interests in exercise and health, endometriosis, fibroids, BRCA patients, and as well as minimally invasive and robotic surgery. Dr. Arruda has been named one of the top docs for the past 3 years by 5280 magazine here in Denver in the field of obstetrics and gynecology. This prestigious listing has recognized Denver area physicians, cited by their peers as the top in their field for more than 20 years. She has also received the University of Colorado's OBGYN Resident Teaching Award and the School of Medicine's Chancellor's Teaching Award. We're very excited to have Dr. Arruda with us today, and I'm going to leap ahead here to pose the 7 questions commonly from patients. That is the context for our presentation today, and then Dr. Arruda will take it from there. The 7 questions, of course, are the ones before you. How many of these procedures do you do every year? What if I have a complication? How frequent are your unexpected procedures? What is the typical hospital stay associated with this surgical procedure? What is the infection risk? Who do I call if I have a problem in the post-op period? And finally, number 7, what is the follow-up plan? With that, Dr. Arruda, please take it away.
All right. What I came to this talk to ask is, how do patients find a good surgeon? And this is remarkably difficult to figure out from a patient's point of view. So I started out with my partners and asking them, what do they think are the qualities of a good surgeon? And this is a little bit like playing The Price is Right, but the very first thing that all of my partners said that made someone a good surgeon was a large volume of cases. It was really interesting. People didn't talk as much about the quality of cases as they talked about the volume of cases that surgeons did, and then use that as an extrapolation to mean quality of cases. The second thing that people really brought up were the complexity of patients that were taken by a surgeon. So anybody in my field can pretty much do a hysterectomy on a nice little BMI of 15 or 20. But most of us who end up taking more complex patients, so the BMI of 50 with hypertension and diabetes and 50 prior surgeries, the surgeons who take those patients, my partners felt like that was a sign of a higher quality surgeon. Obviously, we all want surgeons who have good surgical outcomes, and then in similar association, low complications. And then surprisingly, a lot of my partners who have also themselves been patients felt that a quality of a good surgeon had a lot to do with the ease of pre and post-op care and the experience, if you will, that the patient had with our surgical intervention. So it was remarkably difficult when I acted as a patient looking online to figure out if there was any data, either online or in person, over whether or not a surgeon was high quality. And these are some of the barriers that I found that really hold up our patients to find out anything about their surgical quality. So the first thing I found is that despite searching sort of day and night with all of the things I know as an OBGYN surgeon, there's no online information available about how many cases personally a surgeon does. So it's really hard to look online and say, oh, let me look up Dr. Arruda. I see she did 75 hysterectomies this month or this year or in this decade, and here's how her outcomes were. There are also no published data online for patients to see on individual surgical complications, which is a pretty big deal. And many referrals are sort of word of mouth, i.e. my primary care physician always refers patients to this surgeon, or my friend had a good experience with this doctor, or my mother-in-law said this or that. And I'm going to talk today about if there's any value in that and if there's any data to support that. One big deal, especially in the Denver area, is that your insurance may not cover the best surgeon that you need. And that may not be a big deal if all you need is something simple that everybody does. But if you have something fairly complex, I would say it might be important to go to the best person in that field. And then oftentimes your medical problems may necessitate a higher level of care. We have a lot more flexibility at a university hospital or at a big hospital to take care of just about everybody. But if you have a complex medical history, you may not want to have surgery at your local hospital right next door. So just in looking over what is available online and who has access to it, I found that some hospitals do publish their case numbers and complications. It's very interesting in my field, so in OBGYN, almost no hospitals publish their case number and complications. And I looked through some of the major surgical centers in the United States, who I know from hospital-based data do a lot of hysterectomies, for example. And even those hospitals do not publish their gynecologic surgical numbers and complications online. The best site I had seen was the Cleveland Clinic site. And even that center, which is a huge surgical center, only publishes numbers for about 8 of their most complex procedures. And interestingly, it's kind of a smattering of data. So if you are unlucky enough to need a pulmonary resection at the Cleveland Clinic, you can click on their webpage and you can click on pulmonary resection and you can see how many cases they did in 2005, 2006, 2007, and so forth. And you can see what their published mortality and morbidity rate, meaning how many complications they had and how many people died related to the procedure in each year. And then they give a little smattering of information as to, for example, why people had the surgery and how complicated their medical history. But it's pretty thin. And as a patient, I think you have to look pretty hard to get that information. As a hospital, we have access to quite a bit more quality data information. And what we use predominantly in the United States is called the NSQIP, NSQIP, which stands for National Surgical Quality Improvement Project database. Interestingly, hospitals that participate in the University Hospital Consortium also publish their surgical outcomes under a separate UHC database. And just a little bit of history on NSQIP. It actually started out in the 1980s when many of you may remember that the VA hospitals, some things never change, had been getting some pressure with regard to why their surgical outcomes were seemingly worse than the rest of the country. And so there was actually a congressional law passed that required VA hospitals to show their surgical outcomes in comparison to the national averages. But then when we looked more broadly, there was no published national average for the VA to compare their data to, if you will. So NSQIP was started way back then with a small group of hospitals coming together to pool their surgical outcomes. And now about 600 or 700 hospitals participate in NSQIP, so provide their data on surgical procedures. And for example, last year there were 750,000 or more surgical procedures reported to NSQIP. And the database is great in the sense that you can ask it just for example, hysterectomy outcomes, or you can ask it just for prostatectomy outcomes. And when you query the NSQIP database for your hospital, you'll get your own hospital's personal rate of, say, urinary tract infections after hysterectomy or complications from this surgery or that. You get very personalized data, not per surgeon, but certainly per hospital and per procedure. Interestingly, there have been a ton of studies that have looked at hospitals participating in NSQIP, and they've found that there's actually about a 69% reduction in deaths at hospitals that participate in this quality database, there's a 79% reduction in the overall rate of complications, and there's about a 71% reduction in surgical site infections in hospitals that participate on NSQIP. So the bottom line is, if you ask for your own surgical outcomes and then you get them, you can actually turn it around to make quite a few changes that will improve the quality of your surgical outcomes. And this is like one of those, GI Joe moments of, knowledge being the first step towards improvement, but it is indeed true in this area. What can patients use NSQIP for? That's a little bit less clear, because since they don't work as part of hospital quality, they can't access the database the way we can. But they certainly can find out if their hospital participates in NSQIP, and that might be a sign of a higher level hospital and interest in quality improvement. And then they can also use the surgical risk calculator to figure out their personal surgical risk. So I put that just here on this slide. The left side is just the NSQIP app, and then the right side is the actual surgical risk calculator. So, if I were a patient, I might put hysterectomy in the procedure, and then I'd put, they can't fill in all of those things. They may not know their ASA class and their emergency status and that kind of thing, but they can put a fair number of their risks in to see what the calculator gives them as a surgical risk. And I think that's an interesting tool for assistance in patients who are deciding on surgical quality.